Thank you for coming to Kota, to Pushkar. And today I'm going to show you a case of managing difficult case scenario using a newer technology, which is Z2 nanopulse technology. So Z2 nanopulse technology is a very innovative device which uses the nitrile ring to create a very quick and capsule access. So this is the first case of Z2 pediatric case in a 5-month-old child, and you can see this is a 5-month-old child. The surgery is done general anesthesia. This is the Z2 nanopulse technology which contains the silicone ring and silicone cup and nitinol ring, and this can be inserted through 2.8 mm incision into the address chamber, and you can see here the silicone cup is folded and being inserted into the 2.8 mm incision. The corneal endothelial cells is covered with the viscoelastic viscoat, and you can see within 5 seconds the capsule access is created successfully in a 5-month-old child. So this is one of the very innovative device which can be helpful to manage pediatric cases and the hypermature inflammation cataract, etc., etc. So this is the capsule access being done with the Jepro device. And the second case is the 36-year-old male case of Morgan cataract, and here you can see the anti-capsule staining is done, and to minimize the incidence of complications such as Argentinian flex sign, we can use this device to create a capsule access. And the capsule access is done using the same technique which I have shown you earlier. The cup is folded, inserted into the entry chamber, and this is followed by the successful creation of capsule access within 5 milliseconds. So this is another case of hypermature Morganian cataract, and here you can see this is the third case I am going to show you. And here the device is inserted into the entry chamber, and this is followed by creation of successful capsular access using the Jepro nanopulse technology. You can see this there is a cortical mill, but the access is done successfully. And this is my last case where the access was done in a small people case. I think this note coming. So this device is very helpful to create a capsular access in challenging case scenario such as hypermature cataract, Morganian cataract, pediatric cataract. The downside is that you have to insert the device, and you have to be careful inserting the device in cases like infant and children, and coat the endothelium with a high density viscoelastic or converted subcutaneous viscoelastic such as viscoat. Thank you very much.
Real difficult cases.
For the webinar. It is not a team rebuttal, only one person can do that. Support silently. 3 minutes.
So I will start with Milind. I was surprised. I mean, these cases are very routine. Foreign body removal and RPL. I mean, are you putting our standard down? If foreign body तो हम रोज निकाल देते हैं, PG में, OPD में हम लोग रोज एक foreign body निकाल देते हैं. So I mean, and the video, I was lost at the quality of video. I'm looking at your videos since 20 years. Same video, right? That is the problem. Foreign body routine things, and such a big surgeon of same आता था. निर्मा का वीडियो आया था, इनका वीडियो सेम एक ही दिन पे प्रेजेंट हुआ था. And Pandey sir is saying impossible case. I'm surprised. What is so impossible? You are removing the foreign body, pulling out with a plier is impossible. And second surgery, Dr. Sorabh, philosophy in cataract. I mean, if you have very few cases, what you do is you take up one case, put something inside, keep it rotating like an engine. Enjoy your life. That is the philosophy of that. You are actually enjoying. Midway, you can tell your assistant, no, you can rotate it. I will have a cup of coffee, tea, come back, and again I will enjoy it. Coming back, you are again enjoying it. And then तीसरा Harshul. सर कमाल करते हो खतरनाक था सर। आपने क्या किया सबसे पहले, इन्होंने क्या किया, एक पेशेंट को तैयार किया, मेरे को आरपीएम में केस प्रेजेंट करना है, तो पहले तो आईएल गलत डाल दिया, फिर उसका कैप्चर करवाया, पहले ऑप्टिक कैप्चर नहीं किया पोस्टीरियर, तो उसको जान बूझ कर बेचारा नाम अगर नहीं सर मेरा ठीक हो जाता है सर, उसकी प्रॉब्लम बोला रहे आरपीएम में केस प्रेजेंट करना है, ऐसे न जाओगे यार उसको हम लोग मिलता है फोटोप्लास्टी हमारा अग्रवाल सर को साल हो गया बताया सर, अभी कह रहे हैं ऑडियंस फॉर द सेक ऑफ ऑडियंस बोल दी सर आपने, यहाँ खत्म नहीं हुआ, दूसरा भी पकड़ लिया, दूसरा मिशन पकड़ लिया, दूसरा मिशन का भी कर दिया, फिर बता रहे कि इतनी इजी प्रोसीजर, ऑफकोर्स इट इज इजी, एवरीबॉडी इज डूइंग इट, कर रहा है